satisfying. Make sure nothing hurts, okay?
Okay.
These pilar cysts, I was telling the patient just now that they kind of make the hair a little kinky often because they push on the hair. Before I was numbing this up, you have pretty straight hair, right? These kind of come out like a little kink in it. And you just have a little baby scar line right under there. Nothing really concerning. Sorry if anything's hurting you, you let me know. Sometimes I tug your hair a little. I don't usually trim the hair around here because we women don't like that so much. This is very superficial. I can't even get over the top of it. All right, I'm gonna have to squeeze it here. Squeeze, a little bit of a squeeze. Sometimes I think, do you dye your hair a little bit? You put a little hair dye in it?
Oh, yeah.
A little brown, or a little hair dye gets stuck in them? It's a little bit brown under there, the actual cyst contents. Just gotta make sure I get it all out. This is a pretty viable one. Doesn't want to behave. It likes you. A lot of times pilar cysts are very thick. You okay?
Yeah.
Okay, good. Have you had more than one of these before? You have, right?
Nope.
This is the only one you've ever had?
Yeah.
Because it's not so, it's a, just wants to come out in little pieces. In fact, I'm not totally positive it's a little cyst. I don't think it's anything worrisome, but there's other kind of little growths we can get on top of our head. So we'll check it out under the microscope. I just want to check to see if the edge here is actually, is there a cyst wall here? Because I see much of a cyst wall. I mean, we squeezed something out of there, remember, but the cyst wall isn't that impressive, you know what I mean? Mm-hmm. Like I can't really pull out all the edges. I'm not really sure where it is. So. Sure, thank you. Sometimes they're really impressive and fun. Yours is a little bit not that impressive, I'm sorry to tell you. That's okay.
So you think it was a cyst?
I don't know if it was a pilar type of cyst. Sometimes you can get an epidermoid cyst, which is a regular cyst we see on the body. And those are, the walls are thinner, so they're like harder to get out whole. And because that one just kind of, it was a very thin wall that just kind of smushed out. It's not really in one full piece. So that's what it's not quite as fun because you are not, you know, it's not as satisfying. You don't see the whole thing come out. You know, you see it come out in pieces, so you just can't be totally sure you get it all. So you have to always double check a few times and just to make sure. But it looked pretty clear.
So what kind was it? Wasn't pilar?
I don't know yet. I won't know until. Can you cut that off? I just messed that stitch.
So you have to go get it tested or something. Oh, I see.
Yeah, we'll have it looked at. I have pieces there that I would have it looked at in the microscope just to certainly to make sure it's nothing to worry about. But I doubt it.
Yeah.
Just to double check it, you know, just to be sure.
Right.
A nice pressure dressing on there because kind of did it like a really slow ooze under there. I don't want her to collect anything in there. 3 little stitches we're going to take out in 1 week.
Okay.
I'm sorry, 10 days, I meant to say.
10 days.
10 to 14 days between that time. So let's send that in. Push against this just to make sure. Good, nice and flat though. Looks good.
pretty misleading because there was nothing, there's no mole.
Right. There was no mole, just a bump, and that's not
Yeah.
usually how melanoma presents. So it was actually, maybe it was all happened by chance, and it was a good thing that it prompted us, hey, let's film this, let's do this.
Right.
And we wouldn't have done it in the first place maybe, and thank goodness we did it.
Yeah. Yeah.
Okay, so that's great.
Yeah.
All right, dear. So let's thank you for that. I'll go ahead and do.
Sure.
We're gonna remove these two, and that'll be it.